In the U.S., the Centers for Disease Control and Prevention says it's working to improve safety and infection control to protect those healthcare workers. The CDC, in fact, is sending a team of experts to the Dallas hospital where a nurse became infected with Ebola while treating a patient before he died. Those experts will oversee all aspects of infection control, including how to properly take off personal protective equipment. Medical experts say China's experience dealing with the SARS epidemic puts it in a special position to help contain Ebola. CCTV's Guoxiu reports.
In 2003, Xiaotangshan Hospital in suburb Beijing was a center for isolating and treating SARS patients. The 1,000-bed isolation ward was built in just 1 week. It became a key tool in halting the SARS epidemic, which infected over 5,000 people and killed more than 300 on the Chinese mainland.
Did two things. One is to build up quickly the facilities, infrastructure to help the patients or highly suspected the people to isolate it from the general population, avoid the close contact to continue the spreading the virus. On the other hand, the government has a very strong organized and mobilization the capacities to make the community level the response.
In China's public health emergency response system, there's a rule called early identification, early reporting, early isolation, and early treatment. Governments and individuals are asked to follow instructions that have been written into the country's infectious disease prevention law.
China, anyway, we have the very good traditions. They can follow some professional people, govern the instruction to, like the guarantees in the airport or the guarantees in the community.
SARS taught China a hard lesson. The national campaign didn't start until 5 months after the first SARS case was detected. But the campaign was effective. At its onset, there were 150 new SARS cases a day in Beijing. A month and a half later, there was none. While Wang says a vaccine is essential to ending the Ebola epidemic, controlling its spread is most urgent. Public health incidents not only challenges a country's quality of medical care, but also its social mobilization and organizational ability. The SARS outbreak made the Chinese government and public realize the significance of building a complete public health emergency response system and regulations that the whole country should support and follow. Guoxiu, cctv, Beijing.